Well, I think we've got to look at how the world has reacted and how the world has used LFTs as part of their armoury in relation to detection of the coronavirus. Now, I just don't really understand why the government didn't take a decision as to the widely availability of LFTs, which would have helped on any analysis everyone manage their own healthcare, as well as using the mechanisms in Gibraltar for PCR testing. So I think that they work in combination with PCR testing to help our community generally. So I just query why they've not been made available before and why they cannot be used now to support the system.
The government says it's following the advice of its public health director, something that the GSD has always advocated. So are you saying on this occasion you wouldn't follow the public health director's advice?
No, I just, we're obviously here to question that advice that's being received. The government make a decision based on that advice, but it's quite clear from the world over that LFTs have served a very, very important part of this detection process, that they're all part of the regime, and we just query why that hasn't been utilised here. We understand the rationale that's being sent out to us by the Director of Public Health insofar as Gibraltar's geographical size and the use of these tests and the ability to supervise and properly scrutinise the testing process, but you and I and everyone knows that when you turn up the airport for a swab up your nose, these are being conducted by largely over the summer by students, and therefore there's been some limited training around that, and the supervision of that needs to be sort of catered for. But we need to sort of drill down on that analysis and ask the question, why cannot LFTs be used now?
Well, we actually spoke to the Director of Public Health this morning, Dr. Helen Carter, and she said that they are considering making LFTs more widely available, but through possibly pharmacies under supervision. Would that be an acceptable solution to you?
Well, look, any measure that's now been deployed, and it's very helpful that that statement has now been released saying that LFTs can be used with pharmacies. I think we would welcome a development like that. It's quite clear there has to be an element of supervision over the detection and how that data is collected so we can monitor the spread of the virus within our community. But I think we need to all now take responsibility for testing ourselves at home so that we can learn from the tests that we're doing so that we can then go on to do a PCR. So I think, this virus is with us. It's endemic within our community, and we need to utilise the tools at our disposal to do that. And if the Director of Public Health is now saying that there is a change in the policy towards the use of LFTs, we would support that.
Can I just ask you one question? In your press statement you mentioned that you raised this issue on social media a while back, but I'd like to ask you whether you consider social media the appropriate forum to raise such a serious matter such as this, and why you haven't come forward on this issue before.
Well, look, it's important that we use everything at our disposal to get our message across to the public. Now, many people within our community have often said to us, where is the messaging coming out of? Is it coming out of GBC? Is it coming out of the Chronicle? Social media is part of our lives. We need to utilise that to get the message across. And of course, it is right that we issue public statements from time to time on important issues like this. But social media really gets the attention of people. It gets the debate going within our community, and I think it's right the opposition use social media to do that.